Welcome to NICU in a Nutshell, where we talk about all things neonatal in a simple and easy way to understand. While this isn't meant to be medical advice, it is a place for education, questions, and community. My name is Anna. Let's get started. If you've spent even one day in the NICU, you know how many alarms, beeping, and notifications that go on around you with all of the machines and pumps that are associated with a NICU stay. If this is you and you don't understand why your nurse isn't jumping up every time one of these goes off, this video is for you. Let's talk about alarms in the NICU and why your nurse or provider might not jump every time one goes off. Sometimes reasons for alarms aren't actually reasons. An example of this is squirming around. The adhesive on those wires and probes isn't super strong. So if your baby's squirming around or if they've been on your baby for a few days, if those come off or move, the monitor doesn't know that. So it just reports whatever it sees, which is a funky something going on. But there are ways that we as nurses know that that's happening. For example, the heart rate complexes will look funny that aren't associated with an arrhythmia or something wrong with your baby's heart. Or sometimes the heart rate and the oxygen don't make sense together. So we take those things into consideration before we jump up and intervene. There are also times where we just want your baby to sleep. So if it's one of these reasons that's not actually a reason, we might just keep an eye on it, but we don't want to bother your baby because especially if they're premature, they need as much sleep and rest as they can get so they can grow and thrive, but we will address it next time we're in the bed. Other reasons that a monitor might go off and the nurse might not jump up right away is for something called periodic breathing. And this is something that all babies do, and it's where they stop breathing for a few seconds, and then when they pick it back up, they breathe very fast to make up for it. But what the monitor does is it monitors typically a 6-second view and then calculates what that would be over 1 minute. So if your baby stops breathing for 10 seconds and then does 20 breaths in the next 10 seconds, it's not going to calculate appropriately and it's going to think your baby's had an apneic event and therefore alarm. Additionally, many babies, especially if they're in sleep or deep sleep, they have shallow breathing, and while they are breathing with good oxygenation, the monitor isn't sensitive enough to pick up those small movements in their chest, and it thinks that your baby's apneic as well. But we as nurses, we can see, we can assess before we go and interrupt your baby's rest. Another reason that nurses might not intervene is because we really want to see if your baby can recover on their own. If it's a true bradycardic event where your baby's heart rate drops or apnea where they stop breathing for an extended period of time, we want to know if your baby is able to recover on their own or if they do need our intervention. So we might give it a little bit longer than you're comfortable with, but in a controlled way to see if they're able to do it on their own. This is very important because it does influence the clinical decisions that are made to see if we need to escalate care. The last thing I want to go over on why we might not jump up is mainly targeted towards those older babies we have in the NICU. So the monitors we use have set parameters. For example, heart rate above 160, below 100 will alarm. Those older babies, especially when they sleep, we will accept a lower resting heart rate while they're asleep, but that heart rate might be lower than what our parameters are currently set at. That one's an easy fix. We can change the parameters on the monitor and then it won't alarm as much, but we do change it within a safe range for your baby's gestational age and clinical situation. There are times when the monitor absolutely needs to be addressed. Things like if you notice the oxygen on your baby's monitor is dropping and your baby is turning blue or purple, that needs to be addressed. Like I said before, we really want your baby to recover on his or her own, but if they are not recovering or if the heart rate or oxygen continue to drop, we do need to intervene. This is usually with a little flick to the foot, a rub on the back, something to stimulate them, to remind them to breathe or get their heart rate back up. If that little bit of stimulation doesn't help, occasionally we do need to do something called bagging, where we take the oxygen bag and give them a few breaths to help them remember to breathe and bring their heart rate back up as well. Regardless of what we just went over, if there's ever a situation that you're uncomfortable with or you're curious why something was or was not addressed, please ask your provider, because it's a chance for us to educate you to make you more comfortable with the care your baby's getting. Thank you so much for being here. Please hit the subscribe button so you get notified of our next video and can join our community. Have a great day.